Well, good afternoon. I'm Dr. Tim Peterson. I'm Medical Director for the Blood Center, and we really want to thank you all for coming today. We have some very exciting news we'd like to announce to the community with the help of New Orleans EMS, the Governor's Office for Homeland Security, and with Acadian AirMed here. The Blood Center is one of the founding members of a new organization that's called the Blood Emergency Readiness Corps. We are a group of 30 blood centers throughout the United States that have agreed to provide a steady supply for 2 to 3 weeks at a time, each center participating, in case there's an emergency need for blood immediately. We know that our donors will always respond when there are blood and blood usage that's required for any emergencies, but it's the blood that's on the shelf today that makes it life-saving for the patient. Because when you need blood now. And so, again, the Blood Center is one of the founding members of the Blood Emergency Readiness Corps, and it covers about 30 states in the United States. We anticipate that more blood centers throughout the country will be participating, and that's going to help assure for immediate use of blood and blood components that are available. So, again, just so everyone knows, there is always a need for blood, and of course our obligation is to the patients and family and friends in the region that we service. The Blood Center supplies blood from Baton Rouge to the Gulf of Mexico and around Lafayette, Louisiana, all the way to the Alabama-Mississippi state line on the Gulf Coast. It's approximately 35 plus hospitals with numerous same-day surgery centers, long-term care facilities, any place that requires blood and blood components. There's a good chance that everyone who's hearing us today has a friend or family member who's received blood and has received blood in our region. And of course, our job is to always take care of our patients first. When we can help out other areas, we will. We have to make sure that our patients are always at the top of the list. And to do that, we are asking our donors again. With the recent surge in Omicron, there has been significant drop-off in the collection ability of the Blood Center. We currently are having mobile blood drives that are being put on hold. Many schools are not allowing us to come in to get collections, and that's about 30% of our drives come from high schools and colleges right now. So we really ask people, if possible, please consider being a blood donor. And if you are a blood donor, please consider being a regular blood donor. We require about 350 to 400 pints of blood a day to be collected, just to meet the basic needs of our community. Right now, we are running at about less than 1 day's blood supply. Many times we're having to postpone elective surgeries, and hopefully we'll never have to postpone absolute required treatments that need to go on, such as chemotherapy, long-term blood usage for sickle cell patients or thalassemia patients. So again, we're asking, if possible, please come in, give the Blood Center a call. It's 1-800-86-BLOOD. You can visit us online at thebloodcenter.org, and you can even go on the day of collection. If you'd like, you can fill out your donor questionnaire. We try to make things as rapid and comfortable and as easy as possible for you, because again, without you, our donor, there is no blood supply and there is no treatments for many of the patients who require it. So again, we're here to let you know about the Blood Emergency Readiness Corps, and I'm really happy to have Lieutenant Forcade from New Orleans EMS to come up and give you all an idea of what's going on. Lieutenant Forcade.
All right, thank you, Dr. Peterson. Good afternoon. I'm Lieutenant Jonathan Forcade, New Orleans EMS Public Information Officer. New Orleans EMS is the only ground ambulance service providing 911 pre-hospital emergency care to the visitors and residents of Orleans Parish, with just over 69,000 calls for service in 2021. New Orleans EMS has been an innovator in pre-hospital emergency care for over a decade. Uncontrolled bleeding is the leading cause of preventable death. For many years, our first responders have been able to manage bleeding with tourniquets and other techniques. In October 2021, New Orleans EMS took a big step to decrease morbidity and mortality related to traumatic emergencies by partnering with the Blood Center to be the first ground ambulance service in the state of Louisiana to provide pre-hospital emergency blood transfusions to patients who have traumatic injuries. This means that in addition to bleeding control, our paramedics can now efficiently administer blood to patients in the back of our ambulance. With the opportunity to transfuse blood in the field, New Orleans EMS paramedics can stabilize patients more effectively before transferring care to hospital clinicians. And we have since transfused 19 patients who have qualified for this treatment. With the inception of BERC, New Orleans EMS and local hospitals can now rely on help from a nationwide network of blood centers should there be a large-scale disaster. In fact, BERC can be activated when there are only 5 or more trauma patients. The issue that is currently upon us, though, is a shortage of blood. Therefore, I ask you to please consider becoming a blood donor. We've heard lots about our healthcare heroes lately, but when you contribute to the community, when you donate blood, you become the hero. Call the Blood Center today, set up an appointment, it's super easy. You may be the next person who saves our patient. Thank you for your time. Next, I'd like to call up Mike Steele with the Governor's Office of Homeland Security.
Thank you. My name is Mike Steele. I'm the Communications Director for the Governor's Office of Homeland Security and Emergency Preparedness, or GOSEP. I kind of want to echo what Lieutenant Forcade was talking about. The past 2 years has really been a trying time for everyone, but when you consider what those first responders, those in our medical field, and those providing services for those agencies have gone through, it's quite remarkable. It's been a busy 2 years from us from an emergency management standpoint at the state level. Going back almost 2 years now, we've pretty much been under constant activation since the COVID crisis first began. We see things like this typically become a factor when things like transportation become limited. We've had a number of events over the past couple of years, natural disasters, of course the hurricanes, also the winter weather event last year, and travel can really be impacted. And so the fact that there are agencies out there looking at these issues now is really what we encourage at the state level. We always have a motto of take advantage of blue sky days. And so when you have days where nothing major is going on, you can take a look at these issues and really plan and develop a strategy. So we're really encouraged to see this type of activity, and we encourage everyone to take those steps. Preparedness starts with individuals and families, it expands to communities, and then it goes all the way up to the state and federal level. So anything like these steps that can be done is very encouraging, and we want to do our part. We would likely work with LDH under these circumstances, or our local emergency officials, to help fill any needs, whether it be limited transportation or whatever would pop up related to this type of work. But we want to stand with our partners and be ready to support them any way we can. One thing in Louisiana is, we always think about hurricanes and these major events, but emergencies can happen any day of the week. We have a lot of industrial sites, we have a number of railroads, we have a lot of transportation issues on our interstate systems. We saw that this morning with an incident at the Mississippi-Louisiana line. There's a number of factors that can impact Louisiana at any given moment, and that's why our motto is get a game plan. We encourage everyone to go to getagameplan.org and prepare for those things before an emergency strikes, so that you're ready. And obviously, as we continue fighting through the coronavirus issues, we encourage everyone to stay safe and take the steps necessary to protect them and their families. But thank you for your time today.
Hello, my name is Toni Blanchard. I'm with Acadian Ambulance and AirMed Services. Thank you, Dr. Peterson, and everyone here at the Blood Center for inviting us. The Blood Center is our sole blood provider. We have used, since inception of January 2018, we've used a total of 386 units of blood, and just the year 2021, we used 142 units last year, and we do appreciate and thank y'all. I would also like to reiterate there is a widespread blood shortage, and we also would appreciate if everyone would donate. The primary situations that we use blood are trauma, but we also use it in medical situations also, and we just want to thank you for having us here.
Well, again, thank you. Oh, Dr. Kanter's here. Thank you. Sorry, Doctor.
Thanks so much, Dr. Peterson. And my sincerest thanks, Dr. Peterson, to you and your team at the Blood Center. You talk about a team of folks that work in the background and rarely get recognized for the work that they do. In addition to serving as a state health officer for the state of Louisiana, I'm also a practicing ER doc here in New Orleans. And I can tell you that when we order blood on a patient, which happens every day, multiple times a day, number one, as you mentioned, seconds count. And number two, rarely do we ever think about the folks that helped get that blood there. Process it, get it ready, make sure it's safe. And that starts with the people that give the ultimate gift of donating blood. I think that's really what my biggest ask here is of you is this program is so important to Louisiana. As Mr. Steele said, we have many events here, we have many weather events, and I don't have to remind folks what time of year it is right now where we're on the calendar. So having a support network that can support us if, God forbid, we have the need is very, very important. I would venture to guess we're probably going to be the recipient of this aid, more than most locations would. So, time is of such the essence, and Dr. Peterson and Lieutenant Forcade mentioned this. When we give blood, particularly in a trauma situation, literally seconds count. And I can tell you stories of patients that would have survived if they had gotten to us 2 or 3 minutes earlier, or if we were able to get them blood a little bit earlier, or if they were able to get blood in the field by EMS. Seconds and minutes literally are the matter of life and death when it comes to blood. And having just a day's blood supply on hand, I think, makes me nervous. So I'm thankful for this program. I'm thankful to have a network of blood centers that will support Louisiana, should we, God forbid, need it. But this only works if people are generous enough with their time to donate blood. It's a safe procedure. Anyone can do it. You feel fine afterwards. I've done it many times myself. So looking ahead, rather be safe than sorry. And I'll say this, nobody wakes up in the morning thinking they're going to need blood that day. So give the gift of blood. It's going to help someone who had no idea they would need it. And thank you so much. Dr. Peterson.
Thank you. Again, thank all of y'all for being here and helping us get the word out to, one, ask our donors to please continue coming to be a donor. We asked you for a donation of blood, but we really are asking you something much more important, and that's your time. And that's probably the most valuable thing all of us have, and that we can give to someone else. And truly, an hour of your time can mean a lifetime to a patient who needs it. So thank you for being here. Thanks to all of our representatives. Without their help in the field, patients would certainly have a harder time going at it, and their unselfish time and effort that they put into it are saving lives just like our donors do. So anything that anyone can do to help us with blood and blood donation, please contact us. We're available to set up blood drives at any location, any time, pretty much any organization. And again, we really need your help because there's no way we can manufacture it. We can only get it from the kindness and the generosity of our donors in our region. So thank you very much for being here. Really appreciate it.
Any questions?
Questions?
What is the shelf life for a pump?
Currently, red blood cells are able to be kept in the refrigerator for up to 42 days. Plasma may be frozen for up to 1 year, and platelets, which we use enormous amounts in both trauma and in chemotherapy, bone marrow transplant situations, are only good for up to 7 days on the shelf. So we really have a limited time span where we're able to have products that are readily available, especially in a trauma situation for Dr. Kanter. The product has to be on the shelf, ready to go, because when a donation comes, it takes about a day to 2 days to have all of the required FDA testing to be done. So it truly is the blood on the shelf today is what's available for the patient tomorrow. And so we need to have it available now. And that's why we need everyone to consider being a donor. It's estimated that about 5% of the eligible population in the United States donates blood. And surveys that are produced every 2 years by the National Blood Utilization are showing about a 5% decrease in blood donations every 2 years in the U.S. And currently it's estimated that about 7 to 8 million people provide all the blood used in the United States for an average of about 1.5 donations per donor per year. So it's a very small group of people that are providing almost all of the blood components in the United States. And if anyone has ever donated once a year, would donate twice a year, we'd have very little shortages. And if someone who's never donated just tried once a year, we'd be much safer for ourselves, our friends, and our families. Thank you all very much for helping us out. I really appreciate it.
Has BERC ever been activated?
BERC has been activated. The emergency readiness has been activated at least 3 times since November of 2021. There's an example of course, we know about the Kentucky tornadoes. A lot